Hello, I'm Zetta Thomelin from the Research Council for Complementary Medicine, and I'm here today with Lesley Ward, who won our poster presentation at our conference this year. Hello, Lesley.
Hi, Zetta.
So I'm looking forward to talking to you about your work because I really loved your presentation at the conference. So
Thank you.
could you explain what your research was about?
Yeah, sure. So I was presenting on behalf of quite a big team that worked on this project, and it was a multi-site randomized control trial, and we were looking at the impact of a chair-based yoga program for adults 65 years and older with multimorbidity, so two or more long-term conditions.
Right.
We were looking at the impact of that on their quality of life compared to a control group who proceeded with usual care.
Oh, right. Okay. So what were the findings?
Well, we had quite a large number of outcomes. So our primary outcome was quality of life measured by the EQ5D, and then we had a range of secondary outcomes on quality of life, some mental health outcomes, loneliness. Su-
Oh,
Surprisingly, our findings in terms of our quantitative outcomes were that there was no difference between the chair-based yoga group
that is
and
a
the control
surprise.
group.
Yeah, that is a
So,
surprise.
which was a huge surprise to all of us,
Yeah, yeah,
quite deflating. I'm going to be
yeah,
honest.
yeah, yeah.
Um, and so here's the interesting point: that if the trial had finished there and it had only been quantitative outcomes,
Yeah,
that would have been the answer that we
yeah,
got, that there was no difference.
yeah, yeah,
But fortunately, we had a process evaluation embedded into the trial.
yeah,
So all the way through, we were interviewing participants and yoga teachers about their experiences,
yeah.
and that told us quite a different story. So in a way, that explained the variability of the quantitative
Yes,
outcomes.
absolutely. So what was the feedback you were getting?
The impact of the yoga trial ranged from minimal to
Mm,
transformative.
wow.
So, and that was based on the impact of the yoga on the participants' biopsychosocial outcomes, so their physical, their mental, and their social health.
Mm,
What we found, Zeta, which was interesting, is that we'd made a general assumption at the start because we had very broad inclusion criteria. You only needed to be 65 or older, have two or more long-term health conditions, and be living in the community.
yeah,
That was it.
yeah. Okay.
So there was an assumption that if you had multimorbidity, you were unwell.
Oh, yes. Yeah, yeah,
And what we found is actually that's not the case at all.
yeah,
Because for a lot of conditions, for example, hypertension, they were having, if their medication was working,
yeah, yeah.
then there was no
No, no,
impact of
never mind.
hypertension.
Yeah,
So I think what we found is that we had very, very healthy people at baseline. So really, there was just no room for them
to,
to improve. We
yeah,
had people that were regularly cycling 80 miles a week
yeah,
at
yeah,
baseline.
yeah, yeah,
So for them, there was a minimal impact because they already had a really good quality of life. On the other end of the scale, we found people that, regardless of how many conditions they had, so they might have had two, they might have had eight, but
yeah,
there tended to be one primary condition that really impacted their quality of life. And this is where we were getting feedback that people were finding the yoga transformative,
yeah.
not so much the physical practices, because for a lot of them, their physical ability could be quite minimal.
Yes.
But the feedback, Zeta, was that a lot of them had quite low mood or were quite
Yeah,
anxious about their conditions. And what the yoga did, particularly the breathing practices, which they all pointed out, was that it was helping them to cope with that stress, that
yeah,
anxiety, that low mood
yeah.
about it in a way that had never been addressed through the current medical help that they were receiving for their conditions.
Yes, well, if you haven't been exposed to that sort of thing, you don't know, do you? I mean,
Yeah.
not everybody is. I mean, we tend to assume yoga's more of a female thing. I know it shouldn't be assumed, but it is. Did you find you had quite a mix of people on your trial? What was the makeup?
Yes, and I think this is really interesting. This is one of the statistics I like to pull out when I'm presenting the
Yeah,
results, because
yeah,
as you said, yoga in general is seen as a younger
yeah,
population, white female demographic.
Yeah, yeah, yeah.
What we found in our trial is that we had 40% men,
Oh, wow.
which
Yeah.
was huge. So, and I think that's an interesting point to note too, actually, Zetta, is that, as you know, often in research, the main reason trials don't finish is because they can't recruit.
Yes,
We had the opposite situation in that we had so many people that were eligible at baseline that we had enough to recruit the next round of participants.
that's amazing. Good. Yeah,
And although COVID did happen at the end of the first round,
yeah,
um, COVID hadn't hit when we first began the study. So it wasn't because people were stuck at home with nothing
yeah,
else to do.
yeah.
There was a genuine interest for people to try that. So I think that's very, very interesting to see among that older adult male demographic that this is something that might appeal to them.
And it shows a shift, a bit of perception then, doesn't it? If they feel
Yes,
comfortable doing that and
yeah,
feeling like they might be judged for doing it or
yeah.
yeah.
And I've got a little bit more I can tease out of that if you'd be
Yeah,
interested to hear,
yes.
Zeta. Is that often for the men, again, it wasn't really the physical that they were coming for because they had a lot of exercise routines or that they were doing. But what they found is that it was for the mental health impact.
Yeah.
So managing the mental health impact of a chronic condition, that's what they were finding the yoga really useful for.
Yeah, yeah. That no, that really is interesting. So what next? Have you are you taking this further, or you've got any new projects to go with this?
So that project has finished in itself because that was attached to a set grant.
Right.
But
Okay.
what we've found from the process evaluation is we have some really good information for how to take it forward.
Yeah.
One of the publications we've taken off the trial, which wasn't initially planned,
Yeah.
uh, but I am also a yoga teacher. So I sort of had my yoga teacher eye on when I was
Yeah.
doing the interviews, is that we have published like a teaching exemplar for yoga teachers to teach them some things that may be interesting, particularly for an older adult population when they're teaching yoga, and also for transferring it to online, which our trial gave online delivery because of COVID. We shifted from
Right.
face to face to
Yeah.
online
Yeah.
classes. So a lot of this information is quite useful, Zeta, because it's not the information you would get in a standard 200-hour yoga
Yes.
teacher training.
Yeah.
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 So in terms of taking it forward, I've got a particular interest in focusing more on education for yoga teachers. And also, we've found that one of the pathways that was mentioned by participants and yoga teachers for dissemination is through social prescribing.
Yeah.
So
Yeah.
that's also, we're interested in pursuing more work along that arm, and that will be qualitative. We'll start off with is doing some interviews with health professionals just to look at that field, but maybe bringing awareness of yoga for people with multiple health conditions, but not just for the people themselves, but also for the health practitioners, that
Yes.
they feel that yoga is something that is safe, that they could
Yeah.
signpost their patients towards.
It's safe, it's available, and for their target group. I think the idea of doing it online is useful because if you've got limited mobility or whatever, or what puts some people off is having to get somewhere, isn't it?
Yes.
So if you don't have to get somewhere, it's feasible
Yeah.
for more people. So
Another really interesting thing that came, well, two other interesting things that came out, Zeta, of the online is one that a lot of our older adults are very busy.
yeah, yes,
I
yeah.
can't wait to be retired because there's lots to do. So the benefit of online is that you could just go and do your
Yeah,
yoga and then you're off again.
yeah, yeah.
The other thing that came out, which I found really interesting, was people whose um, impact of some of their mental health conditions made it very difficult for them to sit in a public class,
Right. Yes.
especially if they were beginners and they were trying something new that they didn't have the confidence they were good at. So being able to practice online has really opened that door to, I think, a whole new demographic that have felt that a face-to-face class was something they wouldn't be able to take part in.
That's a very good point because there's this fear
Yeah,
of exposure, of getting it wrong, of not being like everybody else. Yeah, I think that's
yeah,
really interesting.
yeah.
Oh gosh, what a fascinating project, Lesley. Thank you so much for talking to me today, and we look forward to hearing how it develops.
Great.
Thank
Thank you. Thank you for your time. And thank
you.
you very much to the RCCM. It was a wonderful conference, and I really encourage people who don't know about it to look online and maybe consider joining us for the symposium next year.
Thank you, Leslie.